When it comes to supplements for managing irritable bowel syndrome, IBS, and supporting gut health, it's important to note that individual responses and needs may vary. It's always best to consult with a healthcare professional or registered dietitian before starting any new supplements. That being said, here are 5 supplements that are commonly used to support IBS symptoms and promote gut health. In 5th place we have magnesium. Some individuals with IBS may have low magnesium levels, and supplementation can help alleviate symptoms like constipation. Magnesium citrate or magnesium oxide supplements may be beneficial, but it's important to follow dosage instructions and consult with a healthcare professional to ensure it's appropriate for your needs. In 4th place we have digestive enzymes. Digestive enzymes help break down food and improve digestion, which can be beneficial for individuals with IBS who may have difficulty digesting certain foods. Look for a broad-spectrum digestive enzyme supplement that contains enzymes like amylase, lipase, and protease to aid in the digestion of carbohydrates, fats, and proteins. In 3rd place we have fiber supplements. Soluble fiber supplements, such as psyllium husk or methylcellulose, can help regulate bowel movements and alleviate constipation or diarrhea associated with IBS. They work by adding bulk to the stool and promoting regularity. Start with a low dose and gradually increase intake to prevent digestive discomfort. In 2nd place we have peppermint oil. Peppermint oil has been shown to provide relief from IBS symptoms, particularly abdominal pain and bloating. It has a relaxing effect on the muscles of the gastrointestinal tract. Enteric-coated peppermint oil capsules are commonly used for IBS and should be taken as directed. In 1st place we have probiotics. Probiotics are beneficial bacteria that can help restore the balance of gut microbiota. They may provide relief from symptoms such as bloating, gas, and irregular bowel movements. Look for a high-quality probiotic supplement that contains strains specifically studied for IBS, such as Bifidobacterium infantis or Lactobacillus plantarum. Remember, these supplements are not a replacement for a healthy and balanced diet. It's important to address the underlying factors contributing to IBS and to make dietary and lifestyle changes alongside supplements. Working with a healthcare professional can help determine the most suitable approach for your individual needs. If you enjoyed this video, then hit the subscribe button to keep updated as and when new videos are released. Also let us know in the comments section which videos you'd like to see next.